Hi everyone, my name is Dr. Ivette Noriega and I am from El Paso, Texas. So I got a master's from HDFS in 2015 and then I finished my Ph.D. in 2019. I am currently a postdoctoral scholar at the Begun Center for Violence Prevention Research and Education at Case Western Reserve University in Cleveland, Ohio. And my research interest is basically the area of trauma and violence exposure and how that impacts development, particularly like development related to cognitive abilities and memory, as well as emotional regulation and emotional recognition. So at Texas Tech HDFS program, I worked with Dr. Eugene Che, Dr. Elizabeth Trejos Castillo, and Dr. Michael O'Boyle. I decided to attend the HDFS program because, like I mentioned, I was living in El Paso during my high school years. It was very close to home. I had attended Texas Tech University for my psychology degree. And when I was in psychology, I started to basically try to get as much research experience as possible to prepare me for graduate school. And I was able to get in a lab with the HDFS department, and they were working with small children and memory. And I had just a great experience volunteering there as a research assistant during my undergrad that I decided to apply for the post-bac Ph.D. program because I was really interested too in continuing research. So I ended up applying and I got in, and I was really, really happy because I just really enjoyed like the collaborative spirit of the HDFS department. On top of that, I was really interested in gaining research experience with children, which sometimes can be very difficult. Usually you get this experience until you're like in your doctoral program, but I was able to start very early on. One of the reasons that I think I was able to get my current position was because I had a very rich background in terms of my training in the area of human development. The research opportunities I had already been awarded throughout my whole graduate education, which I was able to, supervise a lab, manage undergraduate research assistants, work collecting data, work with very unique equipment that is not readily available in other labs, such as like eye trackers, fMRI machines. And I think if it wasn't for like the technology component of my graduate education and training, I probably would have not gotten my position, because in this current position, I work a lot with large data sets too, and a lot of like a public health approach. And I think the fact that the HDFS program focused a lot in like mental health too, on top of like human development. And that's why you see a lot of like nursing students and pre-med students taking our classes. It's because we do cover a lot of like a wide spectrum of the area of the medical sciences and how that relates to development. So I think that's something that really helped me at least give that competitive edge when I was applying for my jobs and even in my current job position. I also had the opportunity to teach when I was completing my PhD, so that was very valuable because you learn how to apply not only collect research, but how to apply it in a classroom and how to teach future practitioners, future scientists, future advocates on how to understand research and science and how far we've gone through in the decades and decades of research. So I am very thankful for the HDFS department, who always supported me, always provided me guidance as well as mentorship, and allowed me to also have mentorship opportunities for like undergraduate research assistants or allowed me to kind of grow as a researcher and while I was a research assistant. So that's something that I've been very thankful for.